The world seemed to tilt on its axis for Sarah, a vibrant 40-year-old marathon runner. Life as she knew it unraveled in a matter of days. Once a beacon of health and vitality, she was now grappling with a bewildering array of symptoms. It began subtly, a slight forgetfulness, a misplaced word. Soon, however, these minor lapses escalated into a terrifying disorientation. Sarah's usually sharp mind became shrouded in a fog of confusion. Simple tasks, once effortless, now seemed insurmountable. Adding to her distress were the vivid hallucinations that plagued her waking hours. Distorted figures danced at the edge of her vision, whispering menacingly. The throbbing pain in her head was relentless, amplifying her fear and confusion. Terrified and desperate for answers, Sarah's family rushed her to the emergency room. Little did they know that this marked the beginning of a medical mystery, a race against time to unravel the cause of her sudden and alarming decline. The medical team was faced with a daunting challenge, to diagnose and treat an illness that manifested in a myriad of ways, yet eluded easy categorization. The atmosphere in the emergency room crackled with urgency. Every second counted as the medical team assessed Sarah's rapidly deteriorating condition. Her vital signs were stable, but her cognitive function was alarmingly impaired. She struggled to answer simple questions, her words disjointed and confused. Her family watched on, their faces etched with worry and concern. They provided the medical team with a crucial piece of the puzzle: Sarah's medical history. A picture began to emerge of a woman who had always been the epitome of health. She had no significant past medical conditions, no history of drug or alcohol abuse, and was a dedicated athlete who participated in marathons. This information only deepened the mystery surrounding Sarah's sudden decline. What could possibly cause such a drastic change in a seemingly healthy individual? The medical team, guided by a combination of experience and intuition, began to formulate their initial hypotheses, their minds racing to connect the dots and find a diagnosis. Time was of the essence, and every moment brought Sarah closer to an uncertain fate. Before the onset of her symptoms, Sarah's life was filled with familiar routines and joys. She enjoyed her daily runs, cherished moments with friends and quiet evenings at home. But then, strange symptoms began to disrupt her once peaceful life. Dizziness, confusion, and memory lapses became frequent, leaving her and her loved ones worried. Seeking answers, Sarah consulted with her doctor, who began to investigate the possible causes. A series of tests were ordered to uncover the root of her mysterious symptoms. Blood work was conducted to check for infections and other abnormalities. A lumbar puncture was performed to analyze the cerebrospinal fluid surrounding her brain and spinal cord. This fluid could provide crucial insights into the health of her nervous system. As the test results came in, the medical team meticulously analyzed each one, searching for a definitive diagnosis. Yet, the path to understanding Sarah's condition was more complex than they had anticipated. The initial test results painted a perplexing picture. The blood work revealed no signs of common viral infections that could explain Sarah's encephalitis. The cerebrospinal fluid analysis, while suggestive of inflammation, did not pinpoint a specific infectious agent. An electroencephalogram, which measures brainwave activity, ruled out seizure activity as the cause of her altered mental status. Despite the absence of a clear-cut diagnosis, the medical team remained undeterred. They delved deeper into Sarah's case, meticulously reviewing her medical history, symptoms, and test results, searching for any overlooked clues. The possibility of prion disease, a rare and fatal neurodegenerative disorder, was considered and subsequently ruled out through specialized testing. The medical team found themselves at a crossroads. The initial suspicions had been meticulously investigated and ruled out, leaving them with more questions than answers. The mystery surrounding Sarah's illness deepened, and the urgency to find a diagnosis grew with each passing day. Consulting with specialists and employing advanced diagnostic techniques, the team left no stone unturned in their quest for answers. They explored complex medical concepts and reviewed a comprehensive diagnostic plan, determined to solve the enigma of Sarah's condition. Section 5. An unexpected clue. The abdominal pain. As the medical team grappled with the complexities of Sarah's case, a seemingly unrelated symptom emerged that would prove to be the turning point in her diagnosis. Sarah began to experience episodes of abdominal pain, a symptom that had not been present during her initial presentation. At first, this new development was thought to be unrelated to her neurological decline, possibly a consequence of the stress and anxiety she was experiencing. However, a thorough physician, determined to leave no stone unturned, decided to investigate further. A CT scan of the abdomen was ordered to rule out any significant pathology. The results of the scan revealed an unexpected finding: a large mass on one of Sarah's ovaries. This discovery, though concerning in its own right, initially puzzled the medical team. Could a tumor in the abdomen truly be the underlying cause of such severe neurological dysfunction? The answer, as they would soon discover, lay in the intricate connection between the immune system and the nervous system. Section 6. The aha moment, autoimmune encephalitis. The discovery of the ovarian tumor sparked a wave of new questions and hypotheses. Could this be more than just a coincidence? Was there a connection between the tumor and Sarah's neurological decline? The medical team, now working in close collaboration with specialists from various disciplines, began to explore the possibility of autoimmune encephalitis. Autoimmune encephalitis, a rare but increasingly recognized condition, occurs when the body's immune system mistakenly attacks the brain, leading to inflammation and a wide range of neurological symptoms. The trigger for this immune system malfunction can be varied, ranging from viral infections to certain types of cancers. In Sarah's case, the ovarian tumor was the prime suspect. Further investigation revealed that the tumor was, in fact, an ovarian teratoma, a type of germ cell tumor that can contain a variety of different tissues, including hair, teeth, and even brain cells. It was the presence of these brain cells within the tumor that held the key to unlocking the mystery of Sarah's illness. The immune system, recognizing these brain cells as foreign, had launched an attack, inadvertently targeting the brain itself in the process. With the diagnosis of autoimmune encephalitis, Sarah's medical team could now focus on targeted treatments to calm her immune system and reduce brain inflammation, offering hope for her recovery. Section 7. A multifaceted approach to treatment. With the diagnosis of autoimmune encephalitis confirmed, the medical team developed a comprehensive treatment plan. The primary goals were to suppress the overactive immune response and address the underlying ovarian teratoma. A multi-pronged approach was adopted, combining immunotherapy, surgery, and supportive care. Intravenous immunoglobulin was administered to regulate the immune system. Rituximab was introduced to further suppress the immune response. Plasmapheresis was utilized to remove harmful antibodies from the blood. While these treatments addressed the immune dysregulation, the ovarian teratoma remained a concern. Surgery was scheduled to remove the tumor and prevent further complications. The surgery was successful and the teratoma was removed entirely. With the source of the immune system's misdirection eliminated, Sarah's prognosis improved significantly. Section 8. The road to recovery, a testament to resilience. The road to recovery was arduous, marked by both progress and setbacks. The initial days and weeks following the initiation of treatment were particularly challenging. Sarah's cognitive function remained impaired and she continued to experience hallucinations and headaches. However, with each passing day, there were glimmers of hope. The hallucinations gradually lessened in frequency and intensity, eventually fading altogether. The fog of confusion that had clouded her mind began to lift, allowing her to think more clearly and communicate more effectively. Throughout her recovery, Sarah displayed remarkable resilience and determination. She actively participated in physical therapy, regaining her strength and coordination. Speech therapy helped her to regain her lost vocabulary and communication skills. With the unwavering support of her family and the dedication of the medical team, Sarah made steady progress, defying the odds and reclaiming her life. Section 9. Triumph over adversity, embracing life anew. Today Sarah stands as a beacon of hope and resilience. Her now gleams with renewed promise. She has returned to work, her mind as sharp as ever. She laces up her running shoes, her stride strong and confident, as she joyfully tackles her daily runs. Most importantly, she cherishes the precious moments with her loved ones. It underscores the importance of recognizing the subtle signs of autoimmune encephalitis and seeking prompt medical attention. Through early diagnosis, comprehensive treatment, and unwavering support, individuals like Sarah can triumph over this challenging condition and embrace life with a renewed outlook.